my name is Danny, and this is my practical assignment using anatomical terminology. There are three planes of motion. The first is frontal. This divides your anterior and your posterior. In other words, it cuts in half your front and back. A movement that could be used to describe this plane of motion could be a jumping jack. The second plane of motion is your transverse plane of motion. It divides your bottom and your top half. A movement that could describe this plane of motion could be moving from side to side in your trunk area. Finally, we have the sagittal plane of motion. This divides your right side from your left side. A movement that could describe this could be moving your right side and your left side. There are 5 body regions. The first is the cephalic, which is your head area. The next is the cervical, which is your neck. The third is your trunk, which is the entire torso. The fourth is your upper limbs, which is your arms. And the fifth and final is your lower limbs, which is your legs. These are examples for anatomical directions. The first, we have the nasal, which is medial to the otic. Next, we have the scapula, which is lateral to the vertebra. Next, we have the axillary, which is proximal to the carpal. Then we have the palmar, which is distal to the acromial. We also have the clavicular, which is superior to the femoral. And we also have the stomach, which is inferior to the heart. The patella is anterior to the popliteal. The olecranon is posterior to the antecubital. Finally, the heart is deep to the rib cage, and the skin is superficial to the hamstring.